Hi, my name is Dr. Era Datta and I'm a consultant neuropsychiatrist and the founder of Mind Wellness. Mind Wellness is an initiative towards mental health and psychological well-being of everyone. If you are a frontline medical worker, a doctor, a paramedic, a nurse, a support staff, and fighting it has led to a burnout feeling, then we are here to help from Mind Wellness. It is our initiative in the whole of May to help provide you free counseling just to ensure that you are also taken care of, because we know how stressful it is to take care of others and prioritize others' needs in such times. Dear medical health professional, if you are in the need of help, please don't think that you can do it all. Please don't think you're a superhero doesn't need help. Even superheroes need their sidekicks, and we are here to provide you with that mental health help that you require during these tough times. I'm a mental health professional, I'm a psychiatrist, a doctor, and I'm helping so many families fight COVID issues, death of a loved one, the COVID anxiety, their loved ones maybe in the ICU, the grief, so much more, loss of a job, children being at home, not being able to process so much. And I know I am also going through a lot of these burnouts, and that made me wonder that shouldn't other people also get the help that they deserve, especially the medical professionals that they're out there. What are the signs of burnout? If you're a professional who's fighting frontline for COVID-19, you may be facing some of these burnout signs. Number one, sleep issues. You find it really hard to go to sleep. Obviously, the sleep hours are erratic because you're fighting frontline, but still, when you do get the time and you're tired and fatigued, still it's hard to fall asleep. Persistent anxiety, of course, for the obvious. PTSD-like symptoms. There could be nightmares, there could be flashbacks because of seeing so many deaths on a day-to-day basis. Of course, as doctors, we get trained to look at death. However, seeing a pandemic and being a part of it is extremely nerve-wracking for anybody. There could be weight changes. There could be appetite changes. You may lose your appetite entirely. There could even be resorting to drugs and alcohol for some people, because that becomes sort of the safe space. So many doctors report that they can't concentrate, something which is so much needed at this hour. They're grappling with grief. There was a report recently that two doctors who just ended up saying goodbye to their parents and doing the last rites reported to duty for COVID-19 frontline 2 hours later. Imagine how hard that must be. There has been no time to process that grief. There could also be a sense of isolation, cutting yourself out from others. Of course, a lot of families insist that, since you're obviously working in hospitals, you need to have all your arrangements separately, and that could also be so hard. I know how the hearts of doctors break when they come home and they cannot hug their child or be with their loved one because they're so scared constantly about the health of the others. What if they carried back from home? That sense of fear and anxiety is also very real and can cause so much of burnout. And then there is the inevitable fear of a family member battling from COVID, you yourself getting infected, or even a colleague being lost to the whole battle. Yes, this is the reality and the truth of every doctor's life who's fighting frontline right now in the country and all over the world. What can you do as somebody who's not from a medical profession to help someone who's a doctor? First of all, please bring trust to the table when you come and ask for help from any medical professional. Asking for CCTVs in the ICU, demanding for absurd things this is not the time, absolutely. Please respect the doctors. You are also to be respected, and they are also very much deserving of respect. Please ask your doctor how they are. I sincerely believe that doctors are the ones who never get asked how they really are, and that really matters to them. Please be kind and compassionate towards your doctor. If you're a doctor and you need help, we are here to listen at Mind Wellness. My name is Dr. Era Datta, and I do wish that you take care of yourself as well, because you're doing a great job, and we salute to you, dear frontline worker, our dear medical professional. Thank you.